after you go live.
Yes, that sounds
Hey,
great.
look.
Yeah.
I think it works.
There's all
that
check marks.
It sounds so correct. I hear you.
We have 3 check marks.
So
That's
here's
awesome.
the thing. We had 300 people viewing us.
Wait.
Oh,
yeah.
wait. It was only 3.
There was
We lost-
300 of you.
We lost all 3 of our attendees. Okay. So we're a few minutes late, 5 minutes late. Technologia difficulties, but they've got it figured out. So now we're live on Facebook. We're live on YouTube. We're live on Instagram.
We have 3 green check marks. Look how pretty
Is that right, team?
Mm-hmm.
Okay, perfect. Okay. So again, I'm Dr. Emmet from All Out Dental in Las Vegas, Nevada. We're a 3-on-6 office. And we're joined today by Miss Tiffany Terry. And who are you? Besides Tiffany Terry.
I'm Dr. Emmett's assistant.
Really? I was going to ask you today what your actual job is.
Yeah, so I thought about that all the way here. I
What-
was like, crud, what am I?
I don't know what you are.
I know.
We
I
make
have-
jokes about it all the time.
Too many job titles.
What's too many?
Well, more than 3.
More than 3 is too many.
More than 3 is too many.
Okay, so you introduce yourself all the time as Dr. Emmett's implant coordinator.
Yes.
I hear that.
During the consultation. That's how I introduced myself.
And then you are lead surgical assist.
And the only
Surgical assist. So she's basically between you and I,
Yeah.
we are the entire clinical team.
Yeah.
So at our office,
This is the clinical team. Here you
all
go.
we do is
You've-
3-on-6 though.
And you've met half the staff.
That's right.
Because there's
Half
4 of us.
So all we do is 3-on-6. That's
Yeah.
all we do at our office, which is if you're new to this, that's a full mouth restoration.
Mhm.
All we do is 3-on-6, and that's why there can be so few of us, because that's all we do.
Yeah.
But we make up the whole clinical
Plus,
team.
we're a well-oiled machine.
Well-oiled,
Yeah.
well-fed,
We're oily.
oiled machine. Okay, so what we do on these live events, we address questions. So again, we have a whole bunch that were already submitted. We're going to answer all these today. But then you can also ask your own questions live during the event.
Mhm.
So if you're watching and maybe you're new to 3-on-6 or you're a 3-on-6 learner or you've already had your 3-on-6, whatever, this is an opportunity to ask any questions you've ever thought of about 3-on-6. So don't hesitate to submit those and we will make sure to get to them. So obviously, I've been bringing guests on the show and I've been trying to talk you into this for how long now?
Since you started these.
And finally, she agreed yesterday to come on this with me, which I'm super grateful about. We make jokes all the time that we could do a podcast.
I know, we just had to come up with a name.
We
We'll
don't
come
have
up with a name.
So if you have a name for our future podcast,
Put it in the comments.
put it in the comments. That's right. Comment what our podcast could be about.
Yes.
Okay, so I want everybody to get to know you a little bit. Now, guys, the whole podcast, the whole live is not going to be just about this, but I want you to get to know Tiffany Terry a little. So I'm going to tell one fact about you, then I'll let you talk about it.
Okay.
Okay.
Scary.
So no, that's right. So you are an actual royalty because you are a rodeo queen.
Yes.
And I sometimes say that she's a rodeo princess.
And I get really upset about that.
I get in trouble. So
Yeah.
talk to us about being a rodeo queen.
So obviously the difference between a rodeo princess
Well, yeah,
and a
we
rodeo
better talk about
queen
that.
is a princess wears a tiara and a crown wears or a queen wears a crown.
And
So
you got a
I
crown.
had a crown. So let's just be very clear.
So if you're a rodeo queen,
Yeah.
what does that mean? What is that?
You get to go to all the parades and wear pants that you can't breathe in and wave really, all pretty. And at the rodeos, you get to go be part of like the grand entry and different things. I had tons of little girls that were like, I just want to be a rodeo queen. I want to be a rodeo princess. And I'm like,
That's so cute.
it was really fun.
So you rode horses.
Yeah, I rode a lot of
Let's
horses.
break this down to the very baseline here.
You
You
have
were-
to be able to ride a horse.
And
And you have to be able to hold your breath because your pants are very tight.
did you are you a roper? Were you a roper?
Yeah, I wasn't very good at roping, but I wasn't very good at barrel racing.
I was going to say, so that
either,
means you're really good at barrel racing then,
I
right?
was not very good at barrel racing.
right, I bet she was really good.
No. I competed more in like the working ranch horse type stuff, which isn't your typical rodeo event. But that's what I enjoyed doing. So
Okay.
at the rodeo, my hair was always like curled and I was exactly perfect. And then at the actual events that I liked being a part of, I had a ball cap on and like
That's
you would
on
never
brand,
know.
actually.
Yeah, you'd never look
That's
at me
on
and go, oh wow, yeah, that's great.
Okay, so you're like this rodeo farm girl.
I am
growing
a
up.
farm girl. Yeah.
Does that like describe your childhood?
Yeah, 100%. Even yesterday I went and signed my lease for my new house and he was like talking to me about like how to trim the bushes and stuff. And like, he's like, I don't know when. I was like, oh, well, when they go dormant, you trim them with it. And my wife just kind of laughed because she's like, I forget that you had this whole other life before we moved to Vegas. And I'm like, yeah. I'm a farm kid
Yeah.
through and through.
But I've been begging you to take me horseback riding for how many years?
Ooh,
Many. And she has not
3.
yet taken me
I
horseback riding.
haven't. I have to get a horse that we can all ride.
That's a good point. I can't
I
ride.
had to sell all
kinds
my
of horses
horses,
that
so we
you
have to
guys
get.
had.
Yeah.
Okay. We're going to dispel a common myth right now. You actually just said it. You just said my
Oh yeah,
wife.
yeah.
But
This is actually we should have brought this up at the very beginning.
people ask all the time. They come in like, "Are you two married?"
It's funny when they look at us and they go, "Are you two?" And my reaction's always like, "No,
No.
He's like my brother." That's yeah.
But interestingly enough, we're best friends.
Yeah.
So that's weird because you're a girl.
It's not that weird.
Okay. But we're definitely not married. So
No, not married.
somebody just asked, "How do you become a rodeo queen?"
Oh,
We just talked about it.
yeah,
get, like,
it's like
voted in?
it's all like a whole competition. No, it's based on like points and different things. So there's like 3 different parts. There's writing, and then there's like a public speaking type thing. And then obviously you just have to look the part. And back then I very much did. I cut all my hair off just so people would stop asking me if I was competing for the next thing and the next thing. And I was like, cut your hair off. No one asks you if you're going to be a
That
rodeo
was
queen.
it? Just
Yeah.
stopped it?
Mhm.
Okay.
Yeah, stop
Perfect.
all the questions.
Okay. So,
Be included, like, insert a picture right now.
I
oh, that's
They're-
right.
they're-
Put a
I think
picture of her as a
they're- I think
rodeo.
they're
Do you have
all
a
at
picture
my-
of you as a rodeo queen?
I think they're all at my mom's.
Yes, you do. Get us a
I don't-
picture. I want to see a
Daisy
picture.
has my phone.
I
She can go
demand
through
a
'em.
picture.
I'll get one
Demand
when
a
they do the
picture.
snippets of the.
Okay,
the
let's put in a
live, they
picture.
don't have a picture for keeping.
How did we meet?
When I started working for you,
How long ago?
3 years.
3
Yeah,
years.
3 years ago.
Okay. So 3 years ago, and we've been doing surgery together ever since then.
Yeah. When I first started, I worked more in the office, and I only assisted like once a week back when we were just doing a bunch of extractions.
Mhm.
And then one day, Dr. Emmett said, "Oh, we're all going to live in Las Vegas," and I kind of became the only assistant and assisted on all the things.
All the things.
Yeah.
Okay, we're gonna get into like all your experience and stuff here in just a second too. Okay, so I did see a question. This is from Stephen Strong. Dr. Emmett, I currently have a scheduled surgery. That's amazing. At the small clinic here in Colorado this week. Congratulations.
Nice.
This week. That's amazing. I was curious about at what point do we discuss smile design? At the day of surgery or at the 3-month?
So you see Dr. Maxwell.
Yeah. So
Colorado.
first off, you're in great hands. This is amazing. So
Maxwell's
congratulations.
awesome. Yeah.
Next, it depends on each office. So at my office, we do the smile design session when we take your records. That's where you would have had like all the measurements taken, had some scans taken of your mouth to get ready for surgery. But we do it again because we're also going to redo that at your 3-month appointment. So your first set of teeth are your healing temporaries, and you'll be in those for 3 to 4 months while you're healing. And then there's ample opportunity to make adjustments. Now, I take a little extra step at our office because I want your first set of temporaries to be even customized.
As perfect and ideal to you as they possibly can.
So if you're having surgery this week, I got news flash for you. You've already had your smile design session. Anything that would have been done in preparation will have already been done. And that's a very standard, very common workflow. So you'll wake up with teeth from surgery. And then if there's anything that you want changed, you and Dr. Maxwell can talk about those changes
At your 3 months.
at your 3-month appointment. So yeah, good question, Stephen. Follow all the rules. Whatever Dr. Maxwell tells you to do, follow all those rules pre-operatively, post-operatively, and you'll have the best successful outcome.
The soft food diet is your friend.
Yeah, soft food diet.
Soft food diet.
Is our publicist team telling us to do something
I don't know.
different?
She made a
No,
face
I
at
was
me.
just there. I think there was more than one clinic in Colorado, but it's fine.
Oh,
Oh,
I might
Doc-
be wrong. So it doesn't
I
matter.
think-
Whatever. Doctor
okay. Listen,
wants.
if there's more than one clinic in Colorado, here's the bottom line. This is the honest truth. It doesn't matter which 3-on-6 office you go
we all
to.
got the same training.
Yeah,
They
you're
all-
going to be in phenomenal shape because every 3-on-6 provider all went through the same training, and they're all very talented implantologists to begin with. So it doesn't matter where you end up, you're going to be in great hands. It doesn't matter which doctor it is. If you're at a licensed 3-on-6 facility, you're totally covered.
Yep.
So
Yep.
even if there were 2 in Colorado now. And the problem is it's growing so quickly that we used to know every doctor and we used to know every office, but now that we're adding providers, sometimes weekly, monthly basis, we might not know all of them. So
There
good
was someone
point.
on the
team.
provider chat that said something the other day, and I was looking at it. I was like,
Who are you?
no idea who this
Yeah.
is, but sure. I
So,
like
yeah.
what you're saying. Let's go.
Okay, so I wanted to talk about one of the big advantages we have working together is that you came to me with a ton of all on X experience, a lot of surgical experience.
Tons and tons.
And our patients benefit from this. I benefit from this. So just real quick, tell our listeners why you have so much so much all on X experience. We're not going to talk about 3 on 6 yet.
Just full mouth.
Yeah. Why do you have so much full mouth experience?
I worked in an oral surgeon's office in Utah before I went to work for Dr. Emmett. And it was interesting. I was actually the implant coordinator, and the only surgeries I did were the full mouth cases. So when I first started with him, I did all of it, single implants and wisdom teeth and all the things. And one day he was like, "Hey, I want you to be," whatever that means.
Cool.
Sure. And about 3 months after that, I was like, "Hey, I got to go back to surgery." And he's like, "Well, for every full mouth case you sell, you can be the assistant." And give me a challenge. Oh man, we were doing them once or twice a week. So I've done a lot of full mouth, tons and tons and tons of full mouth.
And those were all on X. All on 4, all on X.
All on 4.
Something.
Yep.
Okay.
Yep.
So now, based on that, so full disclosure, she has way, way more experience than I do with all on X. Bottom line, she just does. But how does that translate so well for our patients now? So have you and I ever done an all on X?
No.
But I want you to tell everybody why. Why do you and I not do all on X?
When you first told me we were going to do 3, and I say we're going to do 3 on 6 because it's very much a we thing.
Yeah, it's very much a team decision here.
And I said, that's actually not even possible. So, okay, whatever. And he was like, "Okay, we'll go to the training with me." And I was like, "Okay, I'll go to the training." So I went to the 3 on 6 training with Dr. Emmett. And Dr. Roberts was like, "Hey, before we get started, does anyone have any questions?" And my hand was the first one up.
Of course
he was like, "Are you a doctor?" I was like, "Nope, I'm an assistant, but I have questions." And he was like, "All right." And I asked all the questions, and it was just so logical how Dr. Roberts explained it all. And then when we actually did the surgery, and you don't remove any bone and you don't remove any tissue, and the smile actually looks like the teeth look like they grew there, even immediately after surgery. They look like teeth. They don't look like this big wonky denture. It was such a mind shift for me that when we came back to the office and we decided, okay, this is what we're doing, shut down everything else. It took me, I don't know, 2 weeks before I was like, we're closing down everything else.
Everything else. Yeah, we stopped. Yep. You said we are no longer doing anything else besides 3 on 6 because it's so good for the patients.
Yeah. And it's crazy. Even now, we have a patient who, came in for their 3-month appointment, admitted they hadn't really followed all the rules exactly, had an implant failure. Okay, there's still bone for another implant. So great. You had an implant failure. Okay, took that implant out, put a new one in. It wasn't like, oh, cool, there's no bone left. Or a patient that comes in and they're like, I had an all on X, and we did that this week.
Yeah, we did.
And took an all on X and kind of made it back into 3 on 6. And it's just amazing when we open everything up and I'm like, it's just flat. It's just
wild, huh?
It
looks
crazy.
So weird.
Yeah. Compared to what we do normally. And it's like, oh, let's contour this little piece of bone. And it's just like this little tiny.
Yeah. A lot of effort
dusty.
goes into a 3 on 6
Yeah.
to make it look like natural teeth.
Yeah.
Okay. So you have all this experience with all on X, and now you have a ton of experience with 3 on 6.
Mm-hmm.
So tell me about a surgical difference. So first off, well, let me back up a little bit. 6 months ago, I said to you, hey, I think we should do some all on X. There was a patient that was their only option.
Yeah.
And I said, man, I feel bad because I know I do really good surgery. I know I can do a good job for this patient, but their only option would be an all on X. And what happened when I came to you and said, hey, Tiff, let's do an all on X?
This is how you know we're best friends outside the office. I said, oh, you and what assistant? Because
Yes.
I won't do those anymore.
Won't do it. Why? Okay, so why won't you? Why from your perspective now, lots of all on X, lots of 3 on 6, why won't you participate in all on X?
I use this word carefully,
Ooh,
but
I'm excited.
it's
You don't use any words carefully.
It's barbaric.
Okay.
An all on X surgery it's barbaric.
Yeah.
I
Why?
used to do, you're removing so much that is not necessary. The most I ever charted of bone removal for an all on X was 14 millimeters. And if you don't find a ruler and look at how much a millimeter is, and then 14, and for what? Like there was just no reason. So yeah, we went back and forth with all of that for
A day,
yeah,
maybe 2 days.
maybe 2 days. And I just was like, I don't even when other institutes want you to go teach full mouth, they want you to go teach all on X.
Yeah, we haven't
I'm
talked
like,
about that because we teach.
Yeah.
When I say we go teach, and Tiffany is actually a mentor for a major surgical institute.
the next time we go, it's just me.
I know I'm not going to be
You're,
there.
you're gonna
My
be
son's
you're
getting
gonna
married that week.
you're
that same
at the
weekend.
wedding, and I'm gonna be there. Yeah.
But we won't teach all on X because we believe
I can't even walk in the room anymore because as soon as you can hear certain things and I know what's happening, and I'm like,
you can hear all the grinding of the bone.
Yeah, and there's just it's so unnecessary.
Yeah,
it's so unnecessary.
So that's how
barbaric.
firmly we believe that 3-on-6 is the better option for patients.
Yeah.
And it comes from experience. It comes from a lot of experience doing it. If somebody came in our office right now today and their only option was an all-on-X, what do we tell them?
We usually refer them to
an
an oral surgeon or an office that does a lot of them. We've done that.
Yeah,
we did that recently.
Yeah.
And it was just like it. Yeah.
I can help them on the bottom. I could have done their lower,
Yeah.
but their top, they just had no bone
I think
left.
he'll be back for his lower.
Yeah, he said he would be. So
yeah, he'll be
okay.
back for his
So
lower.
from a surgical perspective, we talked about removing all this bone. What about for the patient's initial recovery? The differences between an all-on-X versus a 3-on-6 initial recovery, what that look like?
It's insane how patients would come in for a post-op appointment, and for a lot of all-on-X, you see them the next day and put the actual prosthesis or the teeth in, and the amount of bruising. Most of these patients look like they had been in a bar fight and lost.
Or a car accident.
Or a car accident. Yeah. I mean, black and blue eyes and down their face and some down their neck into their chest. I mean, and it's just because it's so much bone removal and tissue removal that there's more blood and things, and that causes bruising and so on and so forth. In comparison to our 3-on-6 patients who come in the next morning to get their bite adjusted, and they always are like, oh my gosh, I haven't felt this good in years.
Is that weird?
Every once in a while, we'll have a patient that has a little bit of bruising along their jawline.
Yeah, we've had some minimal bruising.
And they always say the same thing. Oh, I bruise easy.
Yeah, that's true.
Okay, well, perfect.
Our worst patient that had bruising came in the first day we met her, said, I bruise so easy.
I bruise so easy.
Somebody grabs my arm, I bruise. And they had some bruising down in their neck a little bit and underneath their eyes. And that was the most extensive bruising we've ever had.
Well, like swelling. Okay, yeah. Expect a little bit of swelling. You just went through a major surgery.
Yeah.
And even then, the comparison, I mean, I wish there was like a way to, like, maybe they can put a picture up there. I don't know. But the swelling difference, some patients will come in and after a 3-on-6 and have zero swelling and never really feel like they ever did. And an all-on-X patient, you're going to have swelling. There's not a workaround. It doesn't matter what you throw at it, you're going to have swelling.
The patient that we gave finals, we gave her finals or just second set this last week. She said, I still have never had any pain. I've never had any pain, swelling, nothing.
Oh, we put her in seconds. We ordered her finals. Her finals are on the way. I got the email this morning.
Oh, fun. All right.
So we'll put her in finals.
So significantly easier recovery with a 3-on-6 than an all-on-X. Okay. This is a question. Can you go from an all-on-X to a 3-on-6? We did that this week.
We did that this week. Yeah.
2 days ago.
Sometimes.
So it's possible.
Yeah.
Potentially possible.
It's a big question mark.
Yeah.
At the end of it, like sometimes.
It'll be modified.
Yeah.
So her prosthetic will still be modified from a traditional standard 3-on-6. But what she got already, so we did the surgery Wednesday. We saw her on Thursday.
Sorry, yesterday morning. Yeah.
And the amount of room in her mouth now for her tongue.
Oh my gosh.
How did she feel about that when she came in?
She was like, I don't even know what to do with myself. Like, I have all this room. And even day of surgery, when we put the lower teeth in, we both looked at each other and went, her tongue's not going to know what to do with itself. Like, it's going to have so much room for just everything. Like
we took her all-on-X out, obviously.
Yeah.
We set it on the counter and we took a picture of that next to her new teeth. And it's dramatic how much smaller the prosthetic is.
It's like,
with her 3-on-6.
It's like half an inch.
Insert a picture of that.
Yeah.
If you can. Because we have this gigantic all-on-X and then this really dainty, feminine looking 3-on-6. And the screw channels come out right where the teeth are,
instead
of curved back in the palate.
Yeah.
I don't know where that
happens. It's probably a half an inch difference. And if you think half an inch is very much. Imagine getting like a popcorn kernel stuck in your teeth and how well you can leave that alone.
Yeah.
A half an inch in your mouth is drastically different. I realized what I said. Thank you for making a face.
I didn't say a thing. Okay, let's move on. Okay.
He's my best friend.
So let's talk about patients who smoke. And
Yeah.
I talk to patients all the time in the office about this.
I bring it up in the consultation because I think it's important that they hear it before you come in and say, you have to stop.
Yeah.
So I always kind of bring it up just so you know he's going to, and I don't ever look at him when I'm saying it. I'm like just writing on my piece of paper over here, like, ooh, you should.
Okay, so I'm going to bring up something that's interesting about smoking.
Mm-hmm.
When we go and we teach atraumatic extractions
Mm-hmm.
and wisdom teeth extractions, and we've taught hundreds of people, dentists, licensed dentists,
hundreds of just random people off the street.
how to do extractions
Yes. Yeah.
in a safe, great way.
Yeah.
How come I like smoking patients during those training courses?
There's no bleeding. There's no bleeding, and everyone can see.
Yeah, I make my incision,
Mm-hmm.
and there's
Nothing
hardly any blood
happens.
that comes out.
Yeah.
When I was in practice, when I just did wisdom teeth, and I'd make my incision, and I saw smoking on their paperwork. I was like, "This is great."
Yeah, it's gonna be
hardly
that's
any
great.
blood.
Mm-hmm.
So why does that matter for our patients who are trying to get implants?
Well, bleeding brings all the healing, happy properties into your mouth. So if there's none of that, it's not ever going to heal right. So
That's right.
and it seems to be with smoking, it's always your back implants that you can't
It's true.
just skip.
Right.
So sometimes if it's a front implant that failed, you have the option of maybe not replacing it. There's different, workarounds with it.
You just got to a question we're going to talk about.
But yeah,
in a few
but a
minutes.
back implant,
if it's the most
you
back
need those.
implant,
Yeah.
those they fail. That's a big problem.
And it seems to be our smoking patients that those are the ones that that fail on.
And we've had lots of patients who stop smoking sitting in the office during their consultation.
Oh yeah, throw their cigarettes or their vape away
in the garbage can right
Mm-hmm.
there in the office. Yeah. And I always say, I have no idea how hard that would be. I haven't had to stop smoking, but yeah. I'm sure it's terrible.
We can't give up sugar, so can you imagine if we gave up something like nicotine?
That's a good point. I can't imagine how difficult that would be. But then we also have some patients who say they're going to stop smoking, or they'll stop for a week or two, and then they start during recovery. Why is that a problem?
The same thing. It's restricting the blood flow. So especially right as your implants, when your implants go in, they're like super happy, healthy, they got great torque. About 6 weeks later, they're going to be at their most weak, vulnerable time, and you're going to start smoking. And so now not only are they at their most weak, vulnerable time, now you've stopped smoking to give them all the happy nutrients to heal correctly. And for some reason, a lot of patients don't quite correlate the two. They're like, oh, I stopped for a couple of weeks.
Yeah.
Stop.
Or they think, I made it past the first few days.
Yeah.
Everything's going to be fine.
Yeah.
Yeah. You've got to stop smoking for 3 full months. Mm-hmm. And if you're going to stop for 3 months, just quit.
Stop. Yeah.
Okay.
We had one gentleman that he added up how much he spent on cigarettes in the last 10 years. And he's like, I could have paid for this treatment. And I'm like,
that's a good point.
So stop smoking.
Stop smoking.
Mm-hmm.
Okay. So again, if you have any questions, this is an open forum. So feel free to submit those and we will get to your questions. Stephen did reply that is Dr. Maxwell. Okay. So we're on the right track there. You're in great hands. We know Dr. Maxwell. Okay. So let's go on to some other questions. Oh, wait. Other things for you. Before I go to the rapid fire questions. Okay.
We can skip to the rapid fire.
No, because this is important. A patient comes into the office and they say, or they have commented on the forums, I already have an implant. I'm going to insert or 8 because we've taken out 8 implants.
8 implants on a patient.
I already have an implant. Will I save money on my treatment? No. How come?
Most of the time, it is actually a bigger headache to work around your existing implant that someone else placed than it is for Dr. Emett to take it out and put a new one in.
How come?
Tracking down what it is, finding the parts and pieces for it. I think if everyone can understand that there's a million different implant companies and none of them share parts and pieces. Some of them are close, some of them are okay. But each implant then has a million parts and pieces. So our surgery next week, she has 3 existing implants. All 3 of them are coming out. None of them are in great spots.
Okay, so that's what I was trying to get you to say.
Yeah.
What's the likelihood that the implant was placed where I need it?
Yeah. Even my own dad needs to have this surgery at some point. He has 2 implants on his lower right-hand side.
They're replaced by a good surgeon.
They're replaced by a great surgeon. I was there for it. they're actually in places that we would normally put in implants, but are they at the right angulation? Are they I know what they are. I can get the parts and pieces for them. But even then I'm like, they're
But the likelihood
probably
they're in
coming
the
out.
correct spot for a 3 on
Mhm.
6 is so low.
So low.
So will I save money by having implants?
No.
Unlikely.
Unlikely. Yeah.
The ones we're taking out next week, the 3 of them, one's not even in bone. It's like
one of them's
partially
out
like only on the back side. It's out in the soft tissue.
Yeah.
One's at such a weird angle. I don't know if it ended up
I
there, if it
think
was
if
put
you
there.
look at it like, you wouldn't go buy a brand new car and have them have 4 random tires on it. Like, no,
Ooh,
if you're gonna invest in this, you want it to be brand new from the beginning, everything the same. Our case this last week, she had all Neodent implants. We did Neodent implants,
Right.
so that if
To
this
keep the patient in the same. But we used 4 of hers.
We used 4 of
So
hers.
she came in with 8.
Mhm.
Wait,
But she was an all on X that we went back.
Conversion, yeah.
So she came in with 8. We kept 6, put 6 new ones.
That's
She's
correct.
got 12.
Yeah, I was doing the math backwards.
But what's interesting is if she moves, you're welcome to the dentist that gets to take care of that, because it's all the same. Now. It's so hard.
And for the patient, they have all this they have matching stuff in their mouth.
Yeah. So I think that's how I have kind of started looking at it, is you wouldn't go buy a brand new car with 4 random tires. You want them all to be whatever.
Good. I like that. Okay. I say this sentence all the time. I want you to tell patients what it means. This is a judgment-free zone.
Yeah. Patients, a lot of times when they come in for their consultations, they've made this appointment 2 or 3 times and rescheduled, canceled, not shown up, not just with our office, with other offices. And it's just, they are so worried about what you as the doctor is going to say and giving them a hard time. And how many times we have a patient come in and they say, I don't go back to my other dentist because he shamed me about X, Y, and Z.
Yeah.
So immediately right off the bat, this is a judgment-free zone. And Dr. Emmett will say, I don't care what got you here. I'm just ready to help you move forward. And it's true. Whatever is on your x-ray, I promise you, at some point, we've seen worse. A lot of times that day, we've seen worse. I mean, I frequently will tell patients, I'll ask them, hey, do you have any existing implants? Do you have anything? And as they start telling me, it's nice that when I push that x-ray button and I'm watching it come up, I'm like, yeah, I knew I was going to find that. That's great. Sometimes we find stuff and I'm like,
that's
interesting.
Yeah.
That's a new one.
But if I ever said to a patient, your problem is, or why you ended up here, or if you would have if you would have just brushed your teeth, if you would have just flossed, I've never said that to a patient.
No. Sometimes patients will say things like, I started a medication and it dried my mouth out so bad. And you're like, yeah, that's a really common problem.
Yeah.
It's never.
But I'm not giving anybody a hard time for what got them to this place.
Yeah.
Okay. No. That's what a judgment-free zone is.
No, never, ever.
Okay. What can somebody expect during their consultation? Walk us through
45 minutes of awesomeness.
All right.
Yeah.
Talk about that.
So I go through, obviously I introduce myself. Most of the time patients come in, they go, oh yeah, I saw you on that whatever video. And I'm like, oh, cool.
And now they'll see you on this.
Now they'll see me on this. But yeah, I just kind of go over your options. Even though Dr. Emmett only does 3 on 6, I think it's important that you know what your other options are when we're talking about replacing your teeth. So we'll talk about dentures. We'll talk about an all on X. We'll talk about a snappy denture. We'll talk about all those different options. I'll explain why Dr. Emmett only does 3 on 6 and why that's what you should want as well. I have a couple different models in my room that show a 3 on 6, an all on X, a denture, that kind of thing. And as soon as I let you hold that during your consultation, it kind of doesn't really matter what the rest of the conversation is, because as soon as I hand you an all on X compared to a 3 on 6, there's not a comparison anymore. So we'll talk about that. We'll go over pricing and different things. We'll take x-rays, make sure you're actually a candidate. But most importantly, you'll actually have a chance to sit on talk to Dr. Emmett. I'm shocked at how many patients come in and say, oh yeah, I went to insert popular office.
I went to another office.
I went to another office that does
never even met the doctor.
And never even met the doctor. And that blows my mind.
Has that ever happened at our office?
No.
Never.
Never, ever.
They always get me. And do they get 2 minutes with me?
No.
They get 5?
They get as much time. Sometimes I'm sitting there and I'm like,
please stop talking, Dr. Emmett.
Well, sometimes I've got like my chat open and they're like, next patient's here. And I'm like, we got more questions. But never, ever, ever have we rushed you out of the room.
Because we give every patient
Yeah.
every minute that they need.
My desk in the consultation room is a glass top, and he will take an expo marker and draw pictures or like lay out like, hey, these are what your options are. Frequently there's patients that'll come in and they don't need our treatment. They don't need a 3-on-6.
That brings up an interesting point.
Yeah. And you'll sit down and talk to them about what they do need and where they can go and have.
I would say I have
a
2
crown done.
questions today. One,
Mhm.
are you a candidate for the treatment?
Mhm.
And
And
2, even if you are a candidate, do you need this treatment? Is this the right treatment for you? And is 3-on-6 always the best option for every patient? No.
There was a patient last week. She needs a couple crowns and some braces. And she's like, no, I want to do this. And you're like, I'm not taking out your perfectly healthy teeth. Like, I'm not doing
It's
it.
not the best thing for you. You
Yeah.
might be a candidate, but it might not be the best thing for you. So we get to talk about all those things during the consultation. Okay. So just a quick recap. If you are watching, this is a live forum. So if you asked your question, like Mr. Stephen Strong did, we will answer your question right now. So if you have any questions, feel free to ask them. Obviously, if you're watching this at a later date, we're not going to be live, but
Comment on the video.
Comment. Well,
and
somebody will comment back to
we'll
you.
cover it the next time.
okay,
Oh yeah, that's great. To have them post
Yeah,
questions
just-
so that next time we can pull
Yeah.
them off of the
Yeah.
videos. Yeah.
good point. Okay, one last question on the stuff that I had, and then we're going to switch over to the rapid fires.
Yeah.
So why do you think that, so first off, we are not in a bragging way, but we just are one of the top offices for 3-on-6. I don't mean like I mean, we do good work, but I mean the number of procedures that we do.
Yeah.
So we
Consistent number of procedures and patients.
yeah. So we know that we're one of the top offices in the country. So you'd think that it would be the same number of our patients are on all the forums asking questions. But why do you think that our patients are not always on the forums asking recovery questions?
We just had this conversation like 3 days ago.
I know. So why is it?
Someone posted a question and I literally I texted my best friend Jason, but I texted Dr. Emmett and I said, I love that our patients aren't on here asking questions. They just call you. They just text you, or they read if you saw the books that we send you home with that are like your post-op instructions, if you have questions after going through that and watching the videos Dr. Emmett's done,
Yeah, they get a whole video series, right?
Yeah,
of us doing all the recovery.
Yeah.
Everything you need to know about your experience recovering, pre-op, post-op. But then what does every one of my patients get?
They get your cell phone number.
Cell phone number.
A lot of them have my cell phone number now.
Yeah, most of them have yours.
Yeah, a lot of them have my cell phone number.
So
But
when
yeah, they can just
they're
ask you.
recovering, they don't have to rely on social media or opinions of
Or
other
Dr.
people.
Google.
Dr. Google.
Dr. Google will always tell you you're dying. Don't ever ask
Yeah,
Google.
don't ask
Yeah,
him
Google's
anything.
ugh,
But
he's the worst.
our patients just text me directly.
Mhm.
Hey, had a question. Hey,
Or they send you a picture. Hey, is this normal? And like you can,
yeah.
and a lot of our patients don't live locally. A
That's a
lot
good
of our
point.
patients are across the country or at least a few hours away. And you gotten really, really good at doing like FaceTime
Yeah.
post-ops. Like, I don't know. He can walk you through how to hold your lip up out of the way so you can see
So
what
I
you're
take a
looking at.
picture?
And yeah, like
Yeah.
it's
But
Yeah.
our patients just don't have to go. Like I see all the time, hey, I'm having an issue. It's a weekend. Anybody know how to get a hold of such and such office?
Yeah.
I'll never have a patient do that because they all have my cell phone number.
Can we talk about how we don't believe in answering services?
Yeah, so- That's a good point.
An
Let's-
answering service is like one of the
Okay, so
worst patient care
Today's
things.
Friday.
Like it really is.
Is my office open on Friday?
No.
There we are. We're back. So what happens if a patient needs to get a hold of me on Friday?
They call you.
They would call my cell phone number. What happens if a patient wants 3-on-6 and it's a Friday and they call my office? Are they going to get an answering call center in
No,
another country that's going to sit there and try to
No.
talk to them about
when
treatment they
they
don't understand?
call, they'll get the little voicemail thing that says, "Hey, we're not open," but then they'll get a text message that says, "Hey, we're going to get back to you as soon as we can." A lot of times, I know they answer that text message. Secret. Daisy and Amelia have that on their phone. They're seeing I know
Yeah.
Daisy answers comments all
They're
weekend
aware of
long,
you.
so like frequently I'm like, "What did you do?" And she's like, "Just nothing, and she's just answering a quick.
Not only
quick
do you
answer
guys
and-
have it, they have it no answering service,
Yeah.
but me and Emily constantly check it, and if it's
Yeah.
urgent and they lose Dr. Emmett's phone number
Mhm.
for whatever reason,
Well,
Yeah.
it's not a bot. Like
I do
think-
not have an answering service.
Yeah, don't have an AI.
I do not have an
answering.
AI chat bot.
No.
I do not have anybody that would reach out to you and try to talk to you about your treatment that is not a
human.
Actual
real
person.
human who's
Yeah.
knowledgeable about everything, not a salesperson in another country, not an answering company in another place who doesn't know what you really need. Every interaction you get from my office is with somebody who knows 3-on-6. So if it's a Friday, you're like, oh, I think I want to do this surgery, I'm closed. But if you contact my office and somebody replies to you that day, it's a real person.
Mhm.
All the time I see them asking, are you a real person? To our
Yeah,
staff.
they ask that all the time. I don't know if this is a real person.
Yeah.
I'm like,
But
it's a real person.
they for sure will call you on Monday and talk to you about your treatment. Okay. I'm going to do a quick plug. There's something super cool happening. Not that this isn't super cool. This is super
Right.
cool. No, this is really cool. But on the 22nd of this
couple weeks
month.
from now.
Yeah.
Yep.
So August 22nd,
Mhm.
we have a very special guest. We have one of the 3-on-6 ambassadors,
Mhm.
Stephanie Saunders. She will be on this live with me
Yeah.
in this exact same studio doing the same thing. And that's kind of a big deal because she has been, she actually underwent the 3-on-6 treatment
Mhm.
herself. She's obviously brought many friends and family into the 3-on-6 treatment and had them go through it. I hope to talk about some of that with her, but she's an ambassador. So she's very active on the social media platforms on behalf of 3-on-6, answering questions and helping patients through this journey and through this experience. So shameless plug, we have her on here in a couple of weeks.
When we met her, when we went up to the training.
That's right. We met her.
However many years ago that was. And yeah, she's super fun.
Yeah. So
It was cool to sit there and talk to her as a patient before we did the training and have her just be like, no, this is the greatest thing ever. And I'm like, okay,
yeah,
all right.
her perspective on it is super cool.
Yeah.
So we have her coming on in a couple of weeks. All right.
Yep.
So now we have, we're about halfway through. We're on time, a little bit more than halfway through. But we're going to switch over to just do some rapid fire live questions. Now these are for you. Okay.
Oh, for me.
Because
Sweet.
I don't know if you've noticed this today. I've tried to not talk very much and let patients hear
That's
it from,
new for you.
I know it's very, very strange, but that way they can just hear it from somebody else.
Yep.
And hopefully it's the same answer I would give. If not, I'll stop you. Okay.
If not, you'll kick me under the
Yeah,
table.
it's a slight nudge. Okay, why do I wait for 2 weeks before I start to use my water pick?
We want your gums to start doing their thing and closing over all the bone graft and different things that we have in there. Plus, for the first 2 weeks, your gums are, they just went through a major surgery. They're a little bit beat up. So if you start water picking them, they're not going to go back and adhere the way that they're supposed to. So wait 2 weeks. Be aware that the first time you use it, you're going to have some bleeding. It's okay. You're going to rinse out
Copious.
copious
Amounts of
amounts
gunk.
of gunk. It's okay. That's
Totally
normal. Totally normal.
Okay. How long do I use ice packs?
For the first 3 days, ice packs are really awesome. And after that, they might feel good, but they're not doing anything therapeutically. So ice packs for the first couple days. And then after that,
Are
You
they
can switch to
important?
heat.
Do I need to use them?
please do. It
Why?
helps with swelling.
Okay. good
Yeah,
job.
it helps with swelling.
Do the sutures dissolve on their own?
They do dissolve on their own. Most of the time, I tell patients sutures will last 4 to 6 weeks. That being said, we've had patients
Can
go
last
through them a
longer.
lot faster than
That's
that.
true.
And we've had patients we had a patient that came in for her 3-month and she still had a little tiny suture on her upper left. I was like,
That's true.
hello. So yeah, most of the time in about a month, your sutures are going to dissolve. They're super, super important for the first couple of weeks.
But they're also
So,
super annoying.
Yeah.
Yeah.
Kind of pokey.
So patients come in all the time, talk about their sutures
Yeah.
because they kind of poke your lip.
But let's be honest, after a major surgery, if the sutures are the only thing that's bothering you,
That's a good point.
winning.
Yeah.
Yeah.
Coming out ahead.
Winning. Mhm.
What toothbrush do I use? Let's break this up. I'm gonna let you
Let's see,
address
wait,
all.
you gotta
Okay,
have
you
there's
take
a
care
couple
of it.
different. So for the first 2 weeks, you're going to use a super, super ultra soft toothbrush.
Where do I get this super soft toothbrush?
We provide it for you.
Oh, it's given to me by All Out Dental.
Yes,
Okay.
yes. After 2 weeks, you'll get a text message that says, hey, it's time to start using your water pick and switch to a soft bristle toothbrush. Guess what? It's in your bag.
Wait, you
Um,
gave me the water pick?
And the soft bristle
Wait, you gave me
toothbrush.
the other toothbrush?
You don't have to go figure
What?
it out. We give you all the
Okay.
things. And then at the end of your treatment, you are free to go back to using like an electric toothbrush.
Wait, which electric toothbrush?
Oh my gosh, the one that we give you.
Wait, you're gonna give me the right electric
the Oral
toothbrush?
B IO. We should be sponsored by Oral
Yeah,
B.
Oral B, if you're watching,
Yeah.
can we get sponsored? Those are
Oral-B,
expensive.
The IO toothbrush. It's the same one that I use every day.
Me too.
Same one that you use every day.
So we give you all the toothbrushes, we
Mhm.
give you the water pick, and we
Mhm.
give you instructions and a text message on when to switch and start using
Yep.
them.
Yep.
Holy smokes, these guys are really good.
It kind of just takes out all the guesswork
Yeah,
of how to recover from this.
good point.
It's all there.
It's all there.
Mhm.
Okay, what is Stella
I
Life?
love Stella Life.
What
so
is it?
Stella Life, it's a gel mouth rinse and a spray. It's all natural and it's specific for your gum tissue. I didn't really believe in it. I'll be totally honest, call myself out. I didn't really believe in it. And then when we
Kind of
started
hocus
having,
pocus, right?
yeah, I was like, oh yeah, it's gonna help. Sure, whatever, doc. And then patients started using it, and when they would come in, I'm like, wow! After 2 weeks, their
Their
tissue looks
gums
so
look
good,
so good.
and it's not like red and puffy. And the patients who use it, you can tell. The
Yeah.
patients who don't are the ones that are like, my stitches are bothering me, or this is really inflamed. And it's like, well, have you been using your Stella Life? Oh, no.
That's probably why.
You should. Yeah. The spray is more for like
Wait, where do I
bad
get
breath.
Stella Life?
Oh my gosh, we give it to you.
Wait, you give me the
We
Stella
give
Life?
it to you. It's in this cute little
This is
box.
hilarious. Okay, so we give
take
you
the
Stella Life.
guesswork out of the entire recovery.
We might have already talked about this as a rapid fire. How long
Mhm.
does the consultation take?
Usually about 45 minutes to an hour. But it takes as long as it needs to.
Oh, you just took the right answer. That's what I
Yeah, it
was going
takes
to say.
as long as it needs to.
You get
So
as much time as you need.
we've definitely had consultations be shorter, and we've had consultations last
Hours.
2 hours, and then they come back with their spouse, and we
That
answer
afternoon?
all the we answer all the exact same questions
Redo
again.
the whole thing
and-
all over
yeah,
again? All right.
as long as it needs to.
How many implants will I get?
The goal is always 12. 6 on top, 6 on bottom. There's always
Have I ever done more?
yeah.
Have
Oh,
I ever
yeah.
done less?
Yeah.
All right.
Yep. So there's always here's and there's.
12's the goal for full
12's
mouth.
the goal.
All right.
Mm.
I don't want to get complicated. I'm not going to bring it up. Never mind. Okay. Are all patients in 3 bridges per arch? Are all patients in
no.
3 bridges? No.
It
What are they
depends
doing?
on they can sometimes patients end
Stop
up with
cheating
a
and looking at the
single-
list. Look at the camera.
Sometimes patients end up with a single bridge on top or bottom. Sometimes you end up with 2 top or bottom. It's going to come down to where your bone is.
It's not the most common.
It's not the most common. I would
And
say
my goal is to get them into 3.
yeah, most
but
commonly
not everybody's
patients
in 3.
are in 3 on top and 3 on bottom. But we had a patient who she requested a 2 on top with the split right down the middle.
The gap.
Yeah, well, because she's like, I think it looks more natural.
She always had a gap.
Yeah.
She wanted to maintain the gap.
Yeah, sure
Okay.
enough, it does. It looked just like her teeth.
Okay.
So
Who is not a candidate?
who is not a
Who is
candidate?
not a candidate?
Man, that happens so infrequently in our office. When
Okay, so
someone comes in.
I'll take it.
1%.
Yeah, it's
super
such a
complex health
small-
history.
Yeah,
We can have some, but most of the time we can get around some things there.
Yeah.
But super complex health history. How about the patient we said the other day we referred out?
Yeah, he just didn't have enough bone. He had bone height. He didn't have any bone width. So there's certain minimums that you have to have for implants, and he did not meet one of those minimums.
So he still had options.
He still had options.
Some remote anchorage stuff. We're
Yeah.
getting in the weeds a little bit here, but
Yeah.
like zygomatic implants,
Mhm,
pterygoid
transnasal
implants,
implants.
transnasal.
Yeah.
We do a lot of pterygoid implants. In
Mhm.
fact, that's a question down here. We do a lot of pterygoid.
Don't make me spell it. But
Yeah, it's tough. But we don't do in our office zygomatic, and we don't do.
We went to the training
I know.
to do the zygomatic implants, and
Why don't we do them?
we both looked at each other and went, "No, yeah, this is."
Listen, I'm really really good at some stuff.
Mhm.
You're really really good at some stuff.
Mhm.
But we say all the time, we're not everything to everybody. To the right people, we're everything.
We're everything.
But
Yep.
there's some things that I've never even done a zygomatic implant in my office. You don't want me to do it. If you need zygomatics, that's the best thing for you. I want you to get with an expert
that
that
them all the
does that all the
time.
time,
Yeah.
and that's what they do. I'm never going to be foolish enough to think that I have every answer for every patient.
I
So,
think most people watching that will watch this will not know what a zygomatic is.
It's an implant.
that's true. I
that's
got in the
about that
weeds a little
long,
bit.
and it goes and taps into this bone right here.
In comparison to.
In comparison to an implant that's about this big, but it's just in your
Goes into
regular.
the bone.
Yeah, a zygomatic implant is very, very long, and it taps into your cheekbone essentially, right up
Yeah.
underneath your eyeball.
Totally can be a great treatment option, but
Mhm.
not something we do.
I did them with the oral surgeon that I worked with in Utah.
Yeah. Handful of times.
Quite a few times. Yeah, one of my least favorite days is when we were doing one, and he goes, "Go get that textbook off my desk." I'm like,
He wanted to read how to do
We're
that.
reading how to do this right now. He goes, I know how to do it. I'm like, I'm sure you do.
Yeah, they're interesting.
They're
Okay.
Complex.
Actually,
Very
that was the next
complex.
question. What's a pterygoid implant?
A pterygoid implant is slightly longer. It's not as long as a zygomatic, slightly longer than a regular implant. And it goes into the pterygoid
Pyramidal.
yeah.
You
It
know,
goes
say all the
back,
big words?
it goes
No.
back here. It
There's a
goes back
special
here.
bone you have back here.
Mhm.
It's in the pterygoid
Mhm.
area, and we put a pterygoid implant into it. The pyramidal process, let's not go there. But we do a lot of those in office. Those can be a great implant.
And
for patients.
pterygoid, it starts with the letter P.
I have a question.
the worst.
So I saw a video that Dr. Randy Roberts filmed, and he said 99% of patients are candidate
Mhm.
for this procedure.
Yeah.
Do you guys agree with that? And
Okay, so
why so? You guys
we just got asked.
Oh, yeah.
Dr. Roberts made a video, said 99% of patients are candidates for a 3-on-6. Do we see that in our office?
Oh yeah. It's I mean
We have
on
patients that come
one
in
hand,
and we're told you're not a candidate
for an
for an
all
all-on
X.
X.
Yeah.
And now they have a 3-on-6.
Yeah.
Uh,
It's so few and far between when a patient's not a candidate that we almost like it's not
Have
like
to
we
stop and
we're
really,
like,
like,
well,
why?
are they
Yeah.
not? Yeah. So yeah, I agree with Dr. Roberts
Yeah.
100%.
talked about the only time that's usually their medical history or like that one patient.
Yeah.
So that was your 1%.
Yeah.
Yeah.
So I always tell patients, listen, if you're considering full mouth, if you're considering like, I need this as my option,
Mhm.
go see a 3-on-6 provider.
Yeah.
Don't just assume, oh, that's only reserved for patients that are in a certain situation.
No.
Most patients are candidates for a 3-on-6. And if you are a candidate for a 3-on-6, what do I say?
Then you're a candidate for
No, I say you should fight for it.
Oh, I thought he was saying
I say you should fight for it. I say, if you're my mother, my brother, my sister, my uncle, my cousin, I don't care who you are.
fight for
If
it.
you are my family, you
Yeah,
should
fight for
fight for this.
You're an advocate,
Yeah, even
Mhm.
if financially, ironically, the cost for an all-in X and 3-on-6 are pretty much the same. So
Yeah.
this 2 months ago, we were $40,000 less than somebody's all-in X bid.
Yeah. Yeah.
But keep in mind, if you are a candidate and you have to save money for a while, save money because you're going to use these teeth, these implants the rest of your life. Just wait for a little while so you can get the best thing for you.
Mhm.
All right, I'll get off my soapbox. Okay, what happens at the 24-hour appointment?
Oh, we just check your bite. We take some x-rays, make sure that all the placement of all the implants look the way that they're supposed to, which they do, because it's a guided surgery, so it's not very often that it doesn't. And then we check your bite and release you onto your soft food diet. Talk to you about hygiene and different things like that. Most of the time, that appointment's about 30 to 45 minutes.
Yeah.
Yesterday, our appointment was a little bit longer, mostly because we were just having a fun time.
Just had a good time.
Talking to the patient. Yeah, she was just so happy that it was. But it's a super quick, super easy appointment. I think patients get worried that it's going to be painful.
Right.
Your teeth are plastic. It's not going to hurt.
Yeah.
It's not going to hurt. You're gonna have to hear.
Even though you had a major surgery
Mhm.
yesterday, and I'm checking your bite today,
It's not going to hurt.
it's not painful.
Yeah.
Our biggest dental phobics, our biggest wimps, are
Yeah.
totally fine.
Yeah.
Totally fine. Okay. Why do you guys do 2 sets of temporaries? Why are there 2 sets?
So I when I explain this, I want you to think that your first temporary are just your healing teeth. Dr. Emett does everything he can to make them look as perfect and stunning and all the things that you wanted when you talked about it during your records and smile design appointment. But your second set of temporaries is specifically so that you can make any changes to the aesthetics. So let's say you want your teeth longer, shorter, round, square, whatever it is. You will actually get a chance to have those teeth in your mouth. You're going to talk and eat and function with them before we have the lab mill the final zirconia teeth. Once you
theory,
do zirconia,
they're duplicates, right?
Yeah.
The zirconia is a duplicate of
the second
set.
temporaries. Yeah.
So that's why we want them to be ideal and perfect. So that you go, yes, I want these teeth as my permanent.
Which
because
is also why you don't let patients
I
order
know.
their finals the same
it
day we do
almost
their
got
second
us
temporary.
this week
It did, yeah.
because the
Yep.
patient sat in the chair. I gave them their second
I love
set. and
everything about
they're
it.
perfect. I love them. And I said, doesn't matter.
Yeah.
I will not let you make that decision right now in the chair. Go home,
Yeah.
wear them around for a couple of days, and then call me. And sure enough, they called and said, no, can we just change one little thing?
Well, it's easy to change it in plastic.
Right.
Dr. Emett jumps on with the lab, makes a couple changes, reprints them. They're printed in the office. You come in, put those in, perfect. Zirconia, there's not a lot of
I really can't
changes.
adjust them.
No, your bite here and there, but there's not a lot of changing to zirconia.
Yeah. We just got the wrap it up, guys. We only have 3 minutes left. Okay. I'm going to ask you one last question then.
Okay.
So don't say who your favorite patients are, like favorite patient, like they're by name. But let's just talk about your favorite cases, like the types of patients that you get the most fulfillment in this field from.
Yeah.
Who is it? Who are your favorite patients? Does that make sense?
Yeah.
Okay.
So
don't say their names.
favorite type.
Yes. Yeah. Type.
Yeah. I think patients that come in and they're like, yeah, I've been taking care of my mom. I'm taking care of this. I've been taking, and they haven't had a chance to take care of themselves yet. Every single time we put even their second temporaries in, they are emotional about it because it's finally something that they're doing for themselves. We had a patient last week, this week, that we put her in finals. Her reaction was everything.
Oh my gosh, it was so fun.
Her reaction was everything.
I hope that video gets up soon because
Yeah.
it's so fun.
But she's been what?
She said the video just went
But
out.
she was she's been helping her husband build his career, and she's been taking care of kids, and she just kept neglecting her own stuff. And like literally, I mean, she screamed when we put her finals in. She just like lost her mind. And like those are my favorite, like the genuine happy reactions of I finally did something for myself.
I love that. I love that too.
Yeah, out of pain, out of all the crap. Like it's great.
I love that.
So thank everyone and remind them about your next slide.
Yeah. Okay. So this is we just got played off stage. So I'm going to start playing the music at the end of our speech.
That hook's going to come out.
Okay. Again, we are All Out Dental in Las Vegas. We are a 3-on-6 only office. That's all we do. We don't do anything else. If you are considering having a full mouth restoration done, please call us and come in for a free consultation. We can even do those over Zoom. Call 702-710-9006. You can also go to alloutdental.com. That's how you can find us. Obviously, you can go to the 3on6.com website, search for a provider near you. We come up on that as well. And just a huge thank you to everybody who helps put these together for us every week. Thank you so much. The people who ask questions, Mia and Steven, thank you so much. And also to the media team who helps put all this together. And another shameless plug for 2 weeks. You don't want to miss this. We have a 3-on-6 ambassador live here in the studio. So we're super excited about that. So Tiffany, thank you so much for finally agreeing to come on a live event with me. I really appreciate it. This is amazing. So thank you. Again, if you guys have any questions, you can reply to this video or don't hesitate to just give the office a call and let us know how we can help you on your smile journey. Yeah. Sound good? Yeah. All right. Good job today.
We did it.
Good job, buddy.
Thanks, guys.
Okay. See you guys.
Bye.
End session.